Osteoarthritis is a condition of impaired function of muscles, bones, joints, causing pain in these areas and limiting movement, affecting the patient's daily quality of life. There are more than 200 types of bone and joint diseases, classified into two main groups including traumatic musculoskeletal diseases include conditions such as traffic accidents, work accidents or other accidents in daily life, as well as sports injuries. Non-traumatic musculoskeletal disorders include autoimmune diseases, rheumatoid arthritis, spondyloarthritis, systemic lupus erythematosus, autoimmune myositis, scleroderma, crystalline arthritis, such as gout, osteoarthritis, tendinitis, and bone tumors. 1 Osteoarthritis. Osteoarthritis is a condition of damage to cartilage and subchondral bone, often accompanied by inflammation and decreased synovial fluid. Old age is the main cause of osteoarthritis. In addition, other risk factors may include genetics, obesity, previous joint injuries, rheumatoid arthritis, infection, or people who have suffered severe trauma to the joint, such as falls, work accidents, sports. Symptoms of osteoarthritis include pain around the joint. The areas around the degenerative joint often have a dull ache. Initially, rest may relieve the pain, but as the condition worsens, the pain may persist and become more severe. Stiffness. Morning stiffness often occurs in people with osteoarthritis. When waking up, the patient will find it difficult to move, and it takes about 30 minutes for the joint to return to normal. Joint deformities. Degenerative joint areas may swell or muscles may atrophy. Limited activity. Daily activities may be limited, such as bending and turning the head. There are many treatments for bone and joint diseases such as osteoarthritis, including non-drug treatment. Overweight patients will be guided losing weight and apply effective anti-degenerative knee exercise methods. Physical therapy methods are effective in reducing pain and improving poor posture. At the same time, patients need to ensure nutrition for the muscles next to the joint. In addition, patients must focus on treating problems related to tendon and muscle pain, avoiding the situation where the damaged knee joints are subjected to too much pressure. Medical treatment. Use anti-inflammatory pain relievers, oral, topical, or injected directly into the knee joint, along with long-term anti-osteoarthritis drugs such as glucosamine sulfate and chondroitin sulfate, diacerane, piascoldime, and others. Surgical treatment. Surgical methods include arthroscopic treatment of the joint, such as debridement, joint irrigation, osteogenesis stimulation, and other methods such as cartilage cell transplantation, or even joint replacement surgery. 2 Rheumatoid arthritis. Rheumatoid arthritis is a chronic bone and joint disease that affects the entire body. Especially causing arthritis symptoms include swelling, heat, redness, stiffness, and limited movement. Almost any joint can be affected, but is most common in the small joints of the hands and feet. In addition to affecting the joints, this rheumatic disease can also cause damage to other organs such as the heart, lungs, skin, and eyes. Joint damage from rheumatoid arthritis often occurs on both sides of the body at the same time. Rheumatoid arthritis is a type of autoimmune disease, so there is still no complete cure. However, clinical studies have shown that starting treatment early with drugs called DMARDs, disease-modifying antirheumatic drugs, can effectively reduce symptoms. 3 Herniated disc. Herniated disc is a condition in which the nucleus pulposus of the intervertebral disc in the spine slips out of its normal position, putting pressure on the nerve roots, leading to numbness and pain. Causes of this bone and joint disease may include genetic factors, incorrect posture at work, physical activity, natural degenerative processes, accidents or spinal cord injury. Pain radiating from the lower back down the leg, sciatica, due to disease. Lumbar disc herniation is the most common condition in people suffering from this osteoarthritis. 4. Spinal osteoarthritis. Spinal thorn cyst, the phenomenon of extra bone growth on the vertebral body. Cartilage, disc or ligament around the joint. The main cause of this osteoarthritis is due to degeneration of cartilage, disc and bone. The formation of sharp bone fragments. The appearance of spurs and pressure on the nerves, causing the patient to feel pain. Initially, most patients do not experience any symptoms. However, as the condition worsens, the spurs can come into contact with other bone structures and soft tissues such as ligaments, causing increasingly severe pain. Symptoms of spinal spurs include pain in the neck and lower back, especially when the patient stands or moves. In severe cases, pain may radiate from the neck down the arms, or numbness may be felt in the back and radiate to the legs. The pain increases with movement or strenuous activity. The pain may decrease with rest. Therefore, patients often limit movement in these areas to reduce pain. 5. Sciatica. Sciatica, a condition in which pain radiates from the buttocks down the path of the sciatic nerve. There are many possible causes of this musculoskeletal condition. Herniated disc. This is the most common cause. The bulging disc can press on the sciatic nerve, causing pain. Lumbar spine degeneration. Degeneration causes bone spurs to enter the intervertebral foramen, which is where the sciatic nerve exits the spine. Large enough bone spurs can press on the sciatic nerve, causing pain. Degeneration can even cause spinal stenosis, also causes pain. Spondylolisthesis. Spondylolisthesis can narrow the intervertebral foramen in the spine, affecting the sciatic nerve and causing pain. In addition, sciatica can also originate from injuries, inflammation and other causes. 6. Spinal degeneration. Starting from the age of 30, the spine begins to degenerate. The rate of degeneration increases with the patient's age. The process spinal degeneration affecting components such as cartilage, subchondral bone and synovial membrane, in which articular cartilage cells and subchondral bone play a very important role. In the spinal system, there are 3 areas where degeneration often occurs, each with different symptoms. About cervical spondylosis. People with this bone and joint disease often feel pain in the neck area, back of the neck. Pain spreading from the neck to the shoulder and can even spread to the arm. In severe cases, there may be paralysis in the fingers or pain spreading to the top of the head. Tinnitus and causes a feeling of heaviness in the eyes. About lumbar spine degeneration. Common symptoms are pain in the lumbar region. As the disease becomes more severe, the patient may experience numbness from the buttocks to the legs and pain radiating to the feet. About thoracic spondylosis. Less common than the 2 cases above, but patients often feel pain in the chest area, extending to the front of the chest and causing difficulty breathing. 7. Osteoporosis. Osteoporosis is a bone disease that occurs when the metabolic ability of the skeletal system is disrupted, reducing bone strength and increasing the risk of fractures. Bone strength is assessed based on 2 important factors: bone mass and bone quality. Causes of osteoporosis may include changes in hormone production, age, and medication use. In women, in particular, the rate of bone loss during menopause can be as high as 1 to 3% per year, and this condition will last for 5 to 10 years after menopause. 8. Gout. Gout occurs when the body's purine metabolism goes wrong, leading to increased uric acid levels in the blood. Uric acid that exists in the body is eliminated through urine and feces. Causes of increased uric acid in the blood can be due to excessive consumption of foods containing purines, such as animal organs, beef, goat meat, lamb and seafood, or due to impaired ability to remove uric acid from the body, such as kidney failure or genetic problems. High levels of uric acid in the urine over a long period of time can lead to the formation and crystallization of urate crystals in various organs of the body such as the joints, skin, heart, and kidneys. Urate crystals that form in the joints can cause sudden attacks of arthritis, with the joints becoming swollen, hot, red, and very painful, and then improving on their own after a few days. The joints most commonly affected by gout are the big toes, ankles, and knees. As this arthritis progresses, the pain can become more frequent and last longer, affecting other joints such as the hands, shoulders, or elbows. If not treated properly, gout can cause serious consequences such as joint deformity and destruction, disability, as well as heart and kidney failure. 9. Enthesitis. Tendinitis and enthesitis are two common musculoskeletal conditions. There are many tendons in the human body, and most tendons can become inflamed. However, in reality, tendons and tendon attachments at the following locations are more likely to become inflamed: plantar fasciitis, Achilles tendinitis, ankle tendinitis, tendon below the knee, enthesitis of the lateral epicondylitis and medial epicondylitis of the humerus, rotator cuff tendinitis. The symptoms of pain and limited mobility of this osteoarthritis will depend on the affected location, including pain in the heel area, pain in the knee area, pain in the arm area, and pain in the shoulder area. There are many causes of tendinitis and enthesitis, including repetitive movements that put stress on the tendons or inflammatory conditions in the blood that affect the tendons, such as systemic inflammatory diseases such as rheumatoid arthritis, ankylosing spondylitis, etc.